What age then should men say to themselves, this is where I start? And from the doctor's perspective, when would you consider somebody to be high risk?
So, as we have on the screen, prostate cancer, the first screening recommendation, this has changed quite a bit over the last few years, okay? We used to be very aggressive with who we were checking. People were getting checked very early on, and people were getting checked well into their later years. But on average, you're talking about two risk categories. One, those men who are at high risk, and these may be the men who have a high family or a strong family history of prostate cancer, and those that don't have the high risk. So the rule of thumb, or the way that I describe it to patients, and this is based off of the American Urologic Association's new recommendations, is if you have a family history, you probably want to start sometime in your early 40s, 40 to 45. Okay, that's walking into the office, having your rectal exam and your PSA, which is a blood test. If you don't have a high risk, and you can probably start anywhere between 45 and 50, and then from there, really it all depends on the level and what the exam shows. You can get then checked every year or every other year depending on the level of PSA, which is that blood test that I mentioned.
See, now that has changed too over the years, because there was a thinking at one time that if you get your prostate checked, give yourself 10 years, you're fine. Then it became, well, maybe 7, and then maybe 5. Honestly, I have to tell you, I know some people, some men over the age of 50, who get their prostate checked every 2 years.
Sure.
And they're very proud of it, as a matter of fact. So
Sure.
How do you tell the difference in when you get it done?
Yeah. We actually used to check it a lot more. A couple years ago now, the U.S. Preventive Task Force came out and said, you know what, we're doing more harm than good by checking prostates and checking PSAs, again, that blood test. They sort of took the other extreme, where they said we should stop checking. And then that made us, as a urologic community, sit down and say, okay, we need to revamp this. We need to look at this again and see specifically what we should truly be recommending to patients. The new recommendations are based off of more middle of the road. And so it's not uncommon to see a patient who maybe has a very low PSA level, very normal rectal exam, and me tell the patient, you know what, you don't need another rectal exam for another 2 years or every other year. Most of the times, most patients, every year we include it in their physical exam, we include it in their yearly blood work, and that usually maintains the patients feeling comfortable knowing, hey, you know what, I'm being monitored, and it makes us feel comfortable too, saying, okay, we're not going to miss anything here.